Carefully evaluate the urinary bladder wall as well on the CT-KUB, and this is the case to highlight that. Here we have 50-year-old male with history of hematuria. The kidneys are normal, no ureteric calculus, no hydronephrosis. But as we come lower down to the urinary bladder, you can appreciate this soft tissue attenuation area within the left lateral wall, which is most likely to represent transient cell carcinoma. It's very, very important to evaluate not only the lumen of the urinary bladder, but also to look at the wall irregularity and any mass protruding from the wall. On the standard abdominal windows, the soft tissue attenuation usually stands out compared to the urine of the urinary bladder, but sometimes it can be quite difficult, in which case I would suggest to alter the window settings. So what I usually do in abdomen pelvis is I've got another setting which is 110. This is not described much in the literature, but I do this to highlight the change in the lumen and the soft tissue density. I keep the window centering at 10 Hounsfield units, which is very close to the Hounsfield units of the water, slightly more than that, and also I keep the window width as 100 so that the soft tissue attenuation is within that window, and rest of the bone and calcification appears very bright and the fat appears very dark. So in that way, the soft tissue tumor stands out. The window setting here is 110. So this is a trick I use to evaluate the bladder wall abnormalities in CT-KUV.